Hi, everyone. Welcome and thank you so much for joining us for today's webinar titled Toxic Exposures in Women's Health, Emerging Research and Global Solutions. My name is Drew McCarter. I had the honor of taking over the Purist presidency in November of last year. If you're new to Pure Earth, we're a nonprofit celebrating our 26th year of working to protect people from exposure to toxic chemicals. And right now, our focus is really on lead and mercury. Each year, we celebrate International Women's Day in part because women are very much at the center of our work. And what I mean by that is kind of three different things. First, we're a majority women organization, so the implementation teams that are out in the world doing our work are also majority women. But women are also very much the focus of our work as beneficiaries, in part due to the unique risks that chemicals have on women, particularly women of childbearing age, on a fetus and on young children. But then thirdly, because we find that women in the communities that we're serving are often our greatest allies and champions and are incredibly effective agents of behavior change and awareness raising. So today we're pleased to mark International Women's Day as we do each year with an incredible panel of researchers. And this year that includes Dr. Catherine Schilling, Assistant Professor at Columbia University Irving Medical Center of Environmental Health Sciences, Jackie Bowen, Executive Director of the Clean Label Project, Dr. Alejandra Cantoral, Professor at Universidad Iberoamericana, and Dr. Laura Geer, Associate Professor at SUNY Downstate School of Public Health. So, before we get started, just one housekeeping note. Please put your questions in the Q&A box. Some of those will be answered in text, but there will also be time for a live Q&A session with our panelists at the end. And we will kind of determine which questions we answer by text and which ones we hold for the live session. And with that, I'd like to introduce our moderator, Pure Earth's Vice President of Communications, Angela Bernhardt. Angela, over to you.
Thank you, Drew. So good morning, good afternoon, good evening to everyone. I'm very pleased to be moderating today in this be in conversation with four very accomplished scientists who are using their talents to improve health for us all. I think we'll all come away with some new knowledge and insights, and that will strengthen all of our work in public health. So again, thank you, all of you, for being here today. So let's just dive right in. Our first panelist, Dr. Catherine Schilling, is an assistant professor at Columbia University Irving Medical Center of Environmental Sciences, as Drew mentioned. She's an isotope geochemist and has been at the forefront of developing stable metal isotopes as biomarkers and using this novel process to answer a wide array of research questions relevant for the diagnosis, prevention, and control of diseases and nutrient status. Her interdisciplinary approach brings techniques commonly used in earth sciences into solving new problems in biomedical sciences. So thank you for joining us today, Dr. Schilling. So my first question is, tell us about your latest research on heavy metals in menstrual products. There was a paper that you authored titled Toxic Metals in Tampons, Research to Regulations. So could you tell us about the findings?
Yeah, sure. Thank you, Angela, and for the lovely introduction. I'm happy to share some slides to talk a little bit about the research which actually we published last year on metals in tampons. So let me share my screen. So what we did last year, of course, it started a little earlier. The question was asked, I'm an expert in metals, and do we find metals in menstrual products? And we started with the question of, okay, do we find metals in tampons? So the reason why it's important to understand if metals could be in menstrual products is because 1.8 billion women menstruate every month. Then about 100 million women use tampons worldwide. And in the US, 50 to 86% use tampons. So if you think of a lifespan of that women menstruate is about, on average, 40 years. That said means if it is 40 years, women use about over 10,000 tampons or menstrual products throughout their menstrual period of this 40 years. So if you use that many products and the way how tampons are used, it's like the question, okay, what if they contain some chemicals which could be harmful? What does it mean? So if you look at this graph just shows you when you think of metals, why is this important? We need to study toxic metals. It is because most metals cost more a healthy life years than any other chemicals they are out there. We all talk about PFAS. We all talk about phthalates. We talk about PCBs. But if you look at this chart highlighted in red, you see that lead, chromium, cadmium, arsenic, these are toxic metals. They cost more healthy life years than all the other organic chemicals together. So then the question was like, okay, has anyone looked at metals in menstrual products? And if you think of tampons, so tampons are on the market since 90 years. The patent is released 90 years ago. And what we can say was like, oh, no, there are no data available, which was shocking. Okay, then what we did, we just studied 16 metals in 30 tampons. We used 14 brands, 18 products lines, from organic to non-organic, different sizes, from the EU and the US. Okay, and that's what we found. So these are all the metals we studied, and I just want to highlight a few of them because what they are toxic. So we found higher levels of cadmium. You see that in the right corner. This is cadmium, then lead and zinc. These chemicals or these metals were higher in tampons, which are non-organic. And then when you look at the left corner, you see arsenic. Arsenic was higher in organic tampon products. Okay, then the question was like, how do they get into the tampons? That's something we maybe cannot answer. It's not, the answer is not very straightforward. But then after we published the data, it got a lot of media attention. So it was covered from news all over the world. And we got a lot of questions. How did the metals get there? Why nobody has studied it? And I always said, it's a great question. Now we know we need to study it and understand. And in the US, the Democratic Women Caucus even wrote a letter to the Food and Drug Administration and requested that please look into the study. We need to understand more. Why are these metals in menstrual products and could they be of any health concern? And if you compare it, and could there be of any health concern, is a good question, because if you think of, we have regulation for drinking water. So lead in drinking water currently allowed in bottled drinking water is 5 micrograms per liter. And when you compare that, so if you would dissolve a tampon within a liter of water, how much more would it be compared what's allowed in 1 liter of drinking water, the lead levels? So if you see, lead would be 24 times higher in 1 liter of water when we dissolve an entire tampon. And cadmium would be 1.3 times higher. Okay, one might argue, say, okay, but you drink water every day. A tampon is not used every day. It's just like maybe 3 to 4 days a month. But what is very important, the absorption of these chemicals via the vaginal route is 10 to 80 times higher than the dermal when we just put something on your skin or when you ingest it. So that saying is now, okay, if we know that the vaginal absorption is 10 to 80 times higher, what is actually the health risk related to these metals we find in menstrual products? And do we need to do any, is there any information available? And again, what I can say, sorry, there are no data available which has ever studied if these metals are, if we are exposed to these metals through that route in this very sensitive part, we do not know what it does to reproductive health of women or any other disease. And with that, I finished the short introduction of what we did in the study.
Thank you, Dr. Schilling. So my next question was the health risks of using
Yeah.
menstrual products, but as you stated, we don't know. So that's a research question.
Yes.
So, I mean, at this point can you offer any suggestions for consumers on how to protect themselves? Do you know which products are safer, or is this then a question for one of our next panelist? But
M- Maybe that's a question for the next panelist, but what we can but what we can say, what we found is metals were found in all the products tested. Maybe some might say, okay, if you have an organic product, it might be safer than a non-organic. But that's why we said it is not important to say which brand or where the product is from. If it was from the EU or from the US, where regulations are different. In the US, menstrual products are, or tampons are a medical device. So the Food and Drug Administration actually regulates it a little bit more than in the EU. In the EU, it's a consumer product. The regulations are not as strong. So meaning if we find it everywhere, that any regulation is not good enough to say if one product is better than the other. So.
okay.
Mhm.
Okay, so my next and last question for you is I believe that you have some good news to share about a new support for a global initiative. Can you tell us about that?
Yeah, so it's just very exciting. Just recently, last week, we received funding support from the Gates Foundation to actually look into that, to understand when women are exposed to these metals through the very sensitive route of the vagina, is that what health impact it might have. So we are going to study, first of all, we are going to study also different menstrual products around the world. And I think some of the participants for this study are on this call here. But we are looking at, like, can we, with the International Standard Organization, which is part of that, and they have a call, it's called TC338 for menstrual products and safety of menstrual products. Can we have an international regulation or the standard, what chemicals can or cannot be in which level in these menstrual products? But for that, we just need to understand what are the levels worldwide. So then we understand, is it a problem of where the raw material is coming from? Is it a problem coming from the manufacturing? And then needs to be something basically improved to lower these levels in these products. Mhm.
Okay, that's very good news. Congratulations.
Thank
And
you so much.
thank you. And put any questions for Dr. Schilling in the Q&A, please. I know it's confusing between the Q&A and the chat. We're monitoring both, but if you could put them in the Q&A box, we would appreciate that. Okay, next up we have Jacqueline Bowen. She's a Food Safety and Quality Systems Engineer and Executive Director of the Clean Label Project, which is a US-based national nonprofit and consumer advocacy organization that has the mission to bring truth and transparency to food and consumer product labeling. So Bowen was the researcher and co-author behind the largest academic peer-reviewed study ever conducted on lead and cadmium in baby food and infant formula, which was published in The Science of the Total Environment. So Jackie, to start off, can you please tell us about the mission of the Clean Label Project?
Sure. So as you said, Angela, the mission of Clean Label Project is to bring truth and transparency to food and consumer product labeling. For the most part, when you look at the food safety regulatory fabric in America, it's primarily focused on microbial and pathogen contaminants, things like E. coli, Salmonella, Listeria, things that can contribute to vomiting, diarrhea, or worse within 24 to 72 hours. But when we're talking about things like industrial environmental contaminants, and especially like today, talking about things like heavy metals, the reality is that heavy metals can take years, even decades, to manifest themselves in chronic disease. So for us, it's one where it's not like the jury is out. There's very clear evidence that shows here's the long-term repercussions. Here's the impact of lead on the developing brain. Here's the impact of different types of, cadmium on the immune system. So it's one for us that even as we look at industrial environmental contaminants and specifically heavy metals, yes, heavy metals are naturally occurring in the Earth's crust, that because of billions of years of volcanic forces, resulted in the periodic table of elements, and there are certain heavy metals that are essential for life, things like zinc and iron. But at the same time, when it comes to heavy metals, human causes, mining, fracking, industrial agriculture, the use of wastewater for irrigation in the form of pollution can end up in the air, the water, and the soil, and ultimately, in high levels, in the absence of federal regulations, ends up in contaminating food that is provided to the most vulnerable populations.
And your organization specifically offers a service.
That's correct. So for Clean Label Project, what we do is we have a certification program for those brands that are voluntarily opting into thinking about food safety differently. That it's one where you kind of have, the food safety focused primarily on pathogen contaminants, microbial contaminants. It's a matter of rethinking the way that you formulate food, rethinking about the way that you source ingredients, and that you proactively screen for high levels of heavy metals through proactive testing using, state-of-the-art technology, ICP-MS, mass spectrometry, those types of things, in order to proactively look to minimize. The reality is that we're never going to completely eliminate, but we can definitely do better when it comes to sourcing ingredients, formulating ingredients, especially when we're talking about vulnerable populations. The World Health Organization says that first 1,000 days of life from conception till the age of 2 is that primary period of time for optimum brain and immune system development. So for us, it's a matter of this is that critical window, really, that is about proactively looking to start a good long life focused on health and wellness.
Thank you. Okay, so we've talked about this before. There's a new California baby food regulation, California Law AB 899, which newly requires manufacturers to test a representative sample for 4 key toxicants: arsenic, cadmium, lead, and mercury, and publish the results on their websites. So please tell us about the implications of this policy.
Sure. So California AB 899 is a new law that passed in California, but absolutely has national and, quite frankly, international ramifications. So California AB 899 was passed in January 1st, 2024, requiring mandatory heavy metal testing on a lot-based basis of all foods marketed to children under the age of 2, with a carve-out for infant formula. Effective January 1, 2025, all of these test results on a lot-based basis have to be made publicly available on brand websites. So this way, parents and caregivers, really through transparency as a conduit to accountability, that parents have an opportunity to pop the hood, kick the tires, and actually see what exactly, when it comes to heavy metals, is in America's best-selling baby foods. So it's one where it's the first of its kind. It's one where there has been a series of different types of federal regulations that have been at play and in the process of being implemented for several years. Several years ago, within the world of baby food, there was a congressional investigation that looked at the levels of heavy metals in America's top-selling baby foods. It subsequently resulted in a closer to zero efforts by the FDA in order to kind of figure out how can we preserve nutritional density as well as reduce the overall heavy metal impact burden when it comes to America's children. But right now, in terms of laws that have, require transparency of those test results, state of California is the only one that have it implemented. Maryland actually has one on deck. As many of you that are attending today may remember the series of kind of coverage that had taken place. A law was passed in Maryland called Rudy's Law, as coming after the impact of lead poisoning on a child who was consuming certain quantities of the applesauce with contaminated cinnamon. So along those lines, there's different series of exposés and exposures have resulted in different federal as well as state policies.
So this is, obviously a big leap forward, and California is often on the cutting edge of new environmental regulations that others follow. And you expressed concern about what might happen to the rejected lots of baby food that does not pass muster. So can you?
Yes, you're correct, Angela. So one of the things you always have to think about is kind of like this. You can imagine you've got baby food brands that are looking to source good, healthy, nutritionally dense ingredients. And in the process of doing so, not every incoming load, not every lot, not every batch or every ingredient that happens to come in is going to pass muster. some of those, and hopefully they will be actively rejected, so they are not introduced into the baby food supply. And therein lies the question. What I know is that high quality and nutritious baby foods are going to come from high quality nutritious ingredients. High quality nutritious ingredients with low heavy metals come from good healthy soils, and good healthy soils are the byproduct of good environmental policy. But the reality is, if you have a brand that says, I'm not satisfied within this ingredient, well, where does that ingredient go? It doesn't mean that it necessarily turns into livestock feed. It very much can be redistributed through the supply chain back to unsuspecting brands or countries that don't necessarily have that same level of rigor and oversight when it comes to mandatory testing, especially for foods that are going to be ultimately marketed to vulnerable populations.
It's a very important thing for us to keep our eye on somehow. So a slightly different topic. You recently co-authored a paper on heavy metals in prenatal vitamins, which I've been waiting for this paper for 3 years, and I'm excited that it's out. So can you brief us on the findings?
Yes, it's very
Disturbing
exciting.
findings.
It was just published the other day. We haven't exactly figured out all the ways that we're going to look to
So another breaking
promote it
news
as well.
here.
But it's when it comes to prenatal vitamins, here's the reality: is that mothers and mothers-to-be reach for prenatal vitamins before they get pregnant, while they get pregnant, and after they get pregnant, in order making sure themselves as well as their baby gets all those essential vitamins and nutrients. You think about core nutrients like folic acid, methylfolate, that are essential to protect from neural tube defects. In fact, there are studies that show that the compliance in terms of pregnant women taking prenatal vitamins is nearly twice as high as compliance with taking antibiotics. That it's one where, at least speaking for myself, I know that I was pregnant, independent of how you feel, so that you just feel this sense of relief by knowing if I take that prenatal vitamin, I'm going to get my child, my unborn baby is going to get all the vitamins and nutrients they need to be able to grow healthy while still in the womb. So for us, it's one where it's interesting, because when you think about prenatal vitamins, it's one where, yes, vitamins are supplements, but because of their potential to protect from neural tube defects, they're more than that. At least for me and consumers, they are more than that. The other reality is that you have to look at the inextricable link between the health of mother and the health of child. You also have to look at it as that heavy metals can cross that blood barrier, that placenta barrier. And if mom doesn't have the necessary reserves of things like zinc and iron, heavy metals like lead, cadmium, arsenic, mercury also have that potential of being absorbed into the womb. That's why we hear different things on studies that show pregnant women shouldn't eat too much seafood because of the potential for mercury absorption. Same thing applies here. Within looking at prenatal vitamins, that was one of the things that was really startling for us, is that we saw absolutely certain prenatal vitamins and certain folic acid, methylfolate, that had very low levels of heavy metals. And on the other side, we saw some that actually had in parts per million. Typically, when we test for heavy metals, you're looking at parts per billion levels. We saw a handful of products that actually in the parts per million. It's a matter for us when it comes to brands to proactively, like we talked about, proactively formulate differently, knowing that this heavy metals is not only a public health threat, it's also increasing in consumer awareness and concern. It's a matter of aligning that true north with what consumers want, voluntarily thinking about food safety differently for my health of my family as well as yours.
And what was the stat of the percentage that of products you tested that had high levels of metals?
So the thing is, to kind of put it in perspective, it was one where, high levels is kind of a relative term, but it's ones where there was probably only a handful with the levels of heavy metals in the parts per million category, but there were, over 50% that would be in one serving, potentially violating California Proposition 65. That if you look at it as high rate of compliance, high rate of adoption of taking prenatal vitamins, knowing that moms are going to be taking one a day, in this case, and taking one serving a day, do they have the potential to violate the laws that are on the books?
Okay, and the link to Jackie's paper is in the chat, so people can click on that and find out more. So last question, Jackie. So are there prenatal vitamins that are clean label certified? And where can we find information about what's safe to buy go ahead and plug your website and your
Yeah, I appreciate it.
reports.
Thank you so much. Yes, there are plenty of really great brands that have Clean Label Project certified, that are Clean Label Project certified. Check out our website, cleanlabelproject.org. And in general, for parents, caregivers, moms to be, obviously the thing is, take prenatal vitamins. They are essential to making sure that you have a good, healthy pregnancy with a good, healthy child. The biggest thing is that in all categories, whether you're looking at prenatal vitamins, food for your family, any of your family staples that are in the refrigerator or pantry, the thing is to be a conscious consumer, ask questions, demand answers, knowing especially that right now when we look at heavy metals, this is currently things that are typically outside of the scope of federal regulation. It's about especially moms serving as that chief operating officer of their households and really serving as that arbiter of what should end up on pantries, refrigerators, and medicine cabinets in America.
Okay, thanks very much, Jackie. And again, put any questions for Jackie in the Q&A box. Okay, next, we're very pleased to have Dr. Alejandra Cantoral. She's a nutritionist who obtained a PhD in epidemiology from the National Institute of Public Health in Mexico. She's a professor at the Iberoamericana University in Mexico City. She's conducted research collaborating with the National Institute of Public Health and international institutions in birth cohort studies since 2009, and in research lines focused on environmental exposures through food and chronic diseases. She's co-authored more than 130 articles published in high-impact national and international journals, and coordinates several research projects using a community-based approach. Thank you for joining us today, Dr. Cantoral. It's interesting to see your students walking back and forth behind you, clearly on campus. So let's start with, so you're the lead author of the paper, Lead Levels in the Most Consumed Mexican Foods, a First Monitoring Effort. Can you tell us about the findings of your research?
Good afternoon to everybody, and I'm happy to be here, and thanks for inviting me. And I'm also so happy to be to have my intervention after Jacqueline, because what I'm going to present in this first question is inconsistent with the information presented by Jacqueline. And I'm going to share my screen. Okay, can you see now my screen? Yeah.
Yes.
Yes. Okay, that's a full screen.
If you want to click it on presenter mode, then we'll just see. Yep, perfect.
Yeah, perfect. Thank you so much. So as Jacqueline mentioned already, so lead exposure, a common source of lead exposure is contaminated food during the food supply chain. And I want to quote that there's no blood lead level that can be considered risk-free. So this is a toxic metal, and even at low concentrations, it can affect the function of every human organ or system, especially for this vulnerable population as pregnant women and infants or small kids. So one key area in public health nutrition is food safety, but also food regulations. And we all know that in more than 30 countries have conducted the total diet studies. And total diet studies are one of the most cost-effective assessments and tools to have a picture of this dietary exposure at national level to toxic elements. And in Mexico, we don't have a total diet study. But additionally, international agencies as FAO have established standards for maximum limits for lead and other toxins in order to promote food production safety. So 4 years ago, with my colleagues from different institutions, we started this first effort. As I mentioned, we don't have in Mexico a total diet study. We have isolated studies of the amount of lead in some foods that are produced in Mexico, but that's all until now. And 4 years ago, we decided to have the information of our National Nutrition Survey, and we selected the top 100 foods consumed by Mexican population. And then we bought these foods in the markets, principal markets and supermarkets in Mexico City, and we analyzed these foods in the laboratory using spectrophotometry. So as you can see in my slide, so from these more than 100 items that we bought, we detected lead in 18% of the products, but especially as you can see here, 4 items exceed the maximum limits according to FAO. And these foods are commonly consumed by infants because they include infant formula based on soy milk, rice cereals, pre-cooked rice, and whole wheat bread. So we were very concerned about our results, and our next step in my group is to run a baby food monitoring program in Mexico, once again using or taking into account the most consumed baby foods by the Mexican population.
Okay. So did you want to go through the rest of those slides, or we'll just keep doing the kind of Q&A? Okay. So a question. So tell us about your latest research on lead poisoning in pregnant women and women of reproductive age in Mexico.
Okay. So sorry, I'm going to share again my screen, and because this is another topic, just to talk about this research that we have been conducted in different communities, I want to start making like a context in the Mexican population. So lead exposure, it persists in the general population in Mexico, mainly to the presence of lead in food and beverages cooked, served, or stored in low temperature lead glazed ceramics, which is part of our culture and our traditions. So lead oxide is used to melt glazes at low temperature, as we can see in the picture, in traditional ovens. And this is a technique that releases lead to food, particularly to acid food when this food is cooked or served or stored in these ceramics. But I have to say that going back in time, clay pottery is a Mexican tradition and a way of life, because between 10 to 50,000 families produce ceramics in Mexico. So it's one of the oldest craft industries in the country, and with a history dating back to the pre-Hispanic era. So in the 16th century, after the Spanish arrived to Mexico, most pottery pieces began to be glazed with lead oxide. And since then, we have been exposed to lead. And for example, the first medical report of lead intoxication in children date back to the 19th century. So in summary, for centuries, lead glazed ceramics have been the main source of lead exposure in the general population, but these ceramics also represent occupational exposure for women working in the pottery producing industry. So 10 years ago, with Pure Earth Mexico and Netsi Peralta's team, we went to Morelos State and we evaluated 60 pottery workshops producing mainly lead glazed ceramics. So as you can see in the pictures, the workshops are commonly within the central main patio of the houses, which means that all family members, children, women, men, are exposed to this lead oxide. And also, as you can see in this picture, workers don't use any protection when applying lead oxide. So in this first study that we conducted 10 years ago, we evaluated blood lead levels in this pottery population. And we observed that 88% of women had blood lead levels above 5 micrograms per deciliter, which is our reference value for the Mexican normativity. But in this study, we also documented that training on using lead-free glaze in pottery production significantly reduced blood lead levels. However, these efforts to incentivize potters to adopt the lead-free method should be expanded to the thousands of families in this pottery production industry. Then, this is a second study that is a collaboration of various institutions. And we started this study, I have to say that we started this study 6 months ago. So I'm going just to present the preliminary results. And in this case, we are evaluating pregnant women with the support of the health center of a potter population in the state of Puebla. And I have to mention that the state of Puebla is the state of Mexico with the highest children's lead intoxication. About 40% of children between 1 to 4 years present high lead levels in their bloods. So the main goal of this study is to evaluate pregnant women and associate blood lead levels with hypertensive disorders during pregnancy and other outcomes of the liver. So this is the preliminary results, as I mentioned, and you can see here in our graph that all pregnant women evaluated until now are above 5 micrograms per deciliter, which again is the Mexican reference value. And additionally, we are assessing other socioeconomic aspects of these women. And for example, I can mention that many of these women did not receive a salary for producing ceramics. It's just an activity they made to help the husband or their family in these workshops. And it is dramatically when you see the results because, as you can see, once again in the graph, 40% of these women had blood lead levels between 25 to 44. So this is very important for us, and that is why we are working very, very tight with the health clinic of the community, because we want to solve this exposure in these pregnant women. And finally, in addition to occupational exposed populations, I want to present some results of a community evaluation that we started 3 years ago. We look for lead levels in women of reproductive age in Mexico City's low socioeconomic neighborhood. So in this case, women are not exposed to lead through the occupation. However, 21% almost of the women evaluated had blood lead levels above 5. And through a questionnaire, we detected the primary sources of lead exposure, and the main exposures are the current use of lead-free ceramics again, living near a busy street or a highway, and living in a newly remodeled house, which is related to construction materials and old paints. So to finalize these questions, I want to mention that working with women in different settings requires a deep understanding of the magnitude of the exposure, but also to know the context of these women and these communities in order to provide some solutions.
Thank you, Dr. Cantarell. Now, the next question, more of a nutrition focus. So how can diet both cause and be a source of lead exposure or reduce the impacts of lead exposure? And if you can talk to how nutrition can help mitigate the impact of lead exposure, and what does the research tell us about how nutrients and calcium intake can reduce lead absorption?
Well, that's a great question, and Jacqueline already mentioned some things. So mainly food is a source of nutrients and key nutrients, but if the food is contaminated with lead, also is a source of lead or other heavy metals, right? So the presence of lead in food can vary according to so many factors like soil, water, atmospheric emissions, animal feeding regimens, packaging, transportation, storage, cooking methods, as we saw. So food can be contaminated in the food supply chain. But the important thing is that once lead is consumed through these contaminated foods. Adults can absorb around 10% of the amount ingested, but children can absorb 40% of the amount ingested. So the quality of the diet is quite important because absorption of lead is higher when diets are low in key nutrients like calcium, iron, and zinc. So in the studies that I previously mentioned, around 40% of these women evaluated reported having food insecurity at home. And the intake of these key nutrients was very low. They only cover half of the recommendation, of the daily recommendation for calcium, iron, zinc, vitamin C, etc. So it is as a consequence, maybe they are absorbing much more lead than the rest of the population. Now, the good news is that also previous studies done worldwide, but also in Mexico, have shown that a diet rich in food sources of calcium or calcium supplementation even can decrease the amount of lead that it's absorbed in the intestinal tract and also can reduce the amount of lead that is released from bones into the blood, something that happened during pregnancy. So part of our work in these communities has been producing flyers with informations to the health clinics, made trainings to the health personnel in the clinics, going to the participants' houses to detect the sources of exposure, but also going to the community and see the foods available in the community, right? And with this assessing of the community and the houses, we produce some recipe books that use the available foods in the community with combinations of foods high in calcium or iron. So the good news is that, yes, we can do something with diet in order to inhibit lead absorption. The bad news is that some women are in vulnerable situations with food insecurity and they have low quality diets and maybe they are absorbing much more lead, not only them, but also their children.
Thank you, Dr. Cantarell. I would love to get a copy of that recipe book.
Yes, I will send to you.
Like to distribute this, see if we can distribute that.
The thing is that it's in Spanish. So.
Yes, that's okay. Yes, no need to translate. We'll take it. And we look forward to the publication of this, the preliminary data that you shared. So thanks. Okay, next up, we are pleased to have with us Dr. Laura Geer. She's an associate professor and chair of the Department of Environmental and Occupational Health Sciences at the State University of New York, Downstate Health Sciences, and the University School of Public Health. Dr. Geer's ongoing research focuses on the characterization of maternal environmental exposures and associated birth outcomes in ethnically diverse urban immigrant populations, including a focus on exposure to metals such as mercury and chemicals in consumer care products.
Thank you.
First question for Dr. Geer. So I understand you've been working with other researchers and some at Pure Earth in developing a new tool to estimate lifetime impacts from childhood lead exposure, and it's called the LYRIC model. Can you explain what this is and walk us through this?
Yes, absolutely. First, I just wanted to say I'm very honored to be here with such an esteemed panel of women researchers, and I'm learning so much today. Very thrilled. And I'm also happy to share some of the ongoing work that Angela just referred to from our lead exposure reduction and impact calculator, or LYRIC, which combines lead biokinetic uptake estimates for relevant childhood lead exposure pathways with country-specific economic data to generate the costs associated with lead impacts from IQ decrement. And here's just a snapshot of the user interface with our LYRIC instrument, which is ongoing in terms of development. So on the left side, you see the yellow boxes where the user inputs the following characteristics about their population of interest, including whether it's an adult or child, the number of individuals in that population or the size of the population at risk. And then below that, the LMIC region or in country of interest. So those are that particular box there, the WHO region and country are pre-populated pull-down menus for the user's convenience. And you'll see below that, once you input either the exposure pathway via soil and dust for the child, or there's another sheet that shows where you can input dietary inputs, you get an estimated blood lead level. So this tool contributes to some of the efforts around estimating impacts through IQ, because we've gone a couple steps further to model pathways for exposure to the children. There's also a portion, interface. There are basically 3 tabs in the model where you could just go directly from blood lead or BLL values, because sometimes those are the only levels that we have that can kind of indicate exposure and dose in some of our low and middle income countries for this model. So then on the right side, we combine it with economic data from, we use a cost of illness approach. So we're combining information from these country specific economic values, GDP, life expectancy, we estimate lifetime earnings that are country specific, so we can come up with pre and post impacts based on blood lead, then IQ decrement, and then costs associated with each IQ point lost that are country specific. So we can kind of compare and use this as a very practical economic tool to look at various aspects that we would want to utilize this type of tool for in terms of pre and post intervention, which are, these are some of the projects that Pure Earth is directly involved in to look at the value of engaging in remediation programs.
Okay, thanks for that overview, Dr. Geer. So is this available for other researchers to use?
We have gone through several iterations of this model, and we actually engaged some of the country managers. It was really exciting through Pure Earth to come with their inputs and make some, do some runs on our tool. And so that was some of the earlier pre-testing of the tool. We did make it available, but we've been more recently updating the lead biokinetic uptake portions of the model with US EPA's most recent all ages lead model, the AALM version 3 values. So we just wanted to get the model available for researchers and our country representatives to use when we had incorporated some of the most up-to-date features, because the AALM has many advantages over the prior IEUBK model for our applications.
So it sounds like it's in kind of like a beta testing phase and
absolutely. And for those who are
iterate.
interested, please be in touch through Pure Earth, because we can invite you to the presentation when we have the official release, and we really want people to go out there and test and use the tool and continue to give us feedback.
Okay, great. So slightly different question. So what was the impetus for creating this tool, and how can it be useful for policymakers or funders who are involved in the lead space? Like, what's your take on that?
Sure, that's a great question. So we've designed the tool to provide policymakers with these really practical and reliable estimates of the cost of lead exposure and associated impacts. And in mainly for site prioritization, for remediation. So accessing a tool that has these pre-built-in country-specific features of the economic input variables, with what a country manager would come to this, or a policymaker with specific exposure scenarios and the populations of interest that they can easily and readily put into the tool. And so some of the applications or utilizations of this data would be to perform cost-benefit analyses, consider performing remedial projects, demonstrating benefits of a remediation in terms of pre and post intervention BLLs that could be put into the tool, to look at the economic impacts, and to calculate benefits of any proposed actions. And currently, the tool gives this IQ-based impact, but future iterations are queued up to potentially incorporate other health outcomes, including cardiovascular impacts.
Okay, thank you. That's very helpful. Okay, so switching topics slightly. So people who are aware of Pure Earth know that in the last 5 years, we've focused exclusively on reducing lead and mercury exposure. And Dr. Gear, among the many toxins that you've studied in your career, mercury has been a research topic of yours in the past. So can you briefly describe some of your past research and give us kind of a toxicology overview of the health risks from mercury exposure for women and children?
Sure, absolutely. So we know that mercury can pass the blood-brain barrier, transplacental distribution. And so fetal development is a very precious time for the developing brain. And, that's one of the target areas for mercury's impacts. So we engaged in a study in Brooklyn with looking at mercury exposure pathways in a predominantly Caribbean immigrant community. And we looked at, by way of a questionnaire, we looked at maternal urinary levels and cord blood levels with maternal child pairs. And we found just some interesting results that I'm sharing here, is that higher gestational fish consumption and foreign birth of the mother were associated with higher cord blood mercury in the babies. And this is quite interesting. And it really demonstrates quite clearly that the cord blood, the developing fetus is exposed to the mercury quite readily. And the cord blood mercury level is a very efficient way to determine this prenatal exposure, and it really indicates exposure to the developing brain quite readily. And so a type of study like this is really indicating that healthcare providers, our public health agencies, community advocates really play a big role in helping to educate women of childbearing age about the predominant mercury sources, and in the case of just within the US, by way of seafood consumption during pregnancy, because that's the most efficient way that we're going to be exposed to mercury, and in particular during pregnancy. So we have these fantastic aids that we can use to talk about which fish are recommended to be consumed during pregnancy for all the positive benefits that support the development of the brain in the developing fetus, but then also some of the fish selection choices that could put the mother at risk for delivering a dose of mercury to the developing fetus. And so there's some clear, very clear choices here. But what was interesting in our study is we found that some of the fish in this choices to avoid chart here were some of those that were pretty important to sort of cultural celebrations and practices in some of the Caribbean immigrant communities. So we found that really we needed to think about targeted interventions and to really make sure that these fish advisories were and consumption recommendations were getting to the populations that could really benefit. And how this relates to sort of the international setting of mercury, and I'll be talking a little bit about it in just a second. It relates because it's such a predominant source of exposure, the seafood pathway, the fish and seafood pathway. And so there are some sort of more simple ways that we can communicate risk and really alleviate some of the effects of mercury. And Angela, you had asked about toxicity. What are some of the, the targets? And I've been talking about the developing brain. And we've learned about that through, unfortunately, some poisonings that have happened more historically with there was methyl mercury released into a waterway in Minamata, Japan, and it led to a congenital disease characterized by these neurological problems, including intellectual disabilities, coordination issues, and developmental delays in the children. And another thing, I was doing some reading about Minamata and some of the impacts, and they were finding some altered, interesting sex ratios of the offspring, and the babies were born predominantly female. And what was interesting is they were trying to sort of figure that out, and they realized that quite a few stillborn babies happen to be male, so that accounted for some of the findings in terms of those ratios that were a bit off as what would be expected for those trends. So those are just some interesting findings when a community has experienced severe poisoning of the food supply by way of it going into the waterways and bioaccumulating up the food chain. And then there was also an Iraqi cohort that was poisoned by way of methyl mercury being applied to the grain as a disinfectant. And so we've learned a lot in terms of impacts, the prenatal exposure pathway, impacts on the outcomes, developmental and neurodevelopmental delays of the children from, unfortunately, some of these tragic events through poisonings.
Thank you, Dr. Geer. So we're a little bit behind our schedule. So I think I'd like to go right to a discussion amongst the panelists now. So thanks again for all your individual presentations. And so we thought it would be fun to have a chance for you to respond to questions, as a group and have a chance to talk to each other. So the first question is, since we find all your research very interesting, what are some of the most surprising responses that you've received to your research? So, Jackie, can you start us off?
Sure. So I think from my perspective, early on, it was one where I didn't think that there was going to be potentially the level of visceral opposition to the information. It was one where I know early on we did a study looking at the true contents of some of America's best-selling protein powders. So many people are reach a protein powder, bulk up, slim down. So many people here in America are reaching for, Ozempic and other types of weight loss alternatives, want to retain muscle mass, those types of things. And early on, several years ago, when we initially looked at protein powder, we reached out to a bunch of brands like, hey, we did this testing. We would love to share with you the test results. In the interest of public health and continuous improvement, we reached out to over 41 brands, asked them, hey, we've got this data on heavy metals, residual solvents, pesticide residues, phthalates, BPA, BPS. We want to share this information with you. Let us know if you'd like to receive that information. Here's the question. Contacted 41 companies, offered them to give them their data so they can see how it looked. Here's the question. How many do you think took me up on that offer to see their data? Here's the answer. The answer was 2, but it's not what you're expecting. 2 of them sent me cease and desist letters. So rather than take the information and for the sake of making things better and knowing how to move forward, it was more so to try to silence the messenger that this is a very real issue. The issue that I look at is like we've been talking about today, the issue of heavy metal contamination is not a protein powder issue. It's not a baby food issue. This is a ubiquitous food issue that because it is an issue with heavy metals that are going into food, and the inextricable link between public and environmental health is the result of very much the pollution that knows no boundaries, as Pure Earth knows, that because of human causes are exacerbating the problem and making it worse. It's a matter of us thinking about food safety differently in light of current modern day practices of food and agricultural production.
Thank you, Jackie. Who'd like to go next and answer the question about some of the surprising responses to your research?
I'm happy to. So once it got a lot of media attention, and it's interesting that most of the journalists reach out were women, which is great. And then everybody asked, all the women asked, why there wasn't any study before. And I was like, this is a good question. I honestly couldn't answer, which was it's a tough one. It's like why are there no research done? And now I see it, even with all the questions in the chat, I can see it's exactly the same questions. Why, if the products are out for such a long time and the way they are used, why nobody has looked or does a screening of, I would not only say metals, but the chemicals in general in this product, and why is there no more transparency on if they can be there? Because there's, for example, in the US, there's for menstrual products a very, very long list on patents, what can be added to the products. But of course, they can be all added, but we don't know if these chemicals could be of any harm for the women once they use the product, and then over such a long time. So yeah, that was very surprising that I got always the question, why no one has done it before? And then at least we do it now. That's what we can say. We do it now.
Catherine, one of the things when you were saying that I was thinking about is also how women have traditionally been underrepresented when it comes to just clinical trials in general, as well as people of it's just typically white males are the ones that make up clinical trials. And that's kind of like the default in terms of the populations. Also different people, populations of color have been underrepresented. So I think just women's health in general has been underrepresented, funded, and all of that results in these types of heavy hitting public health repercussions when important research like yours, Catherine.
Okay, anyone else want to respond to that question?
Well, I also want to mention that we also have a lot of media attention every time that we publish a paper. But the sad thing is that we don't have a national strategy in order to solve these problems, in order to monitoring food production and to monitoring toxics in the food supply chain. But also we have an ancestral problem in Mexico, and we haven't had find a solution for these problems. We have isolated efforts in some communities with some groups, but there's not like a big solution for all the states of Mexico, for the thousands of families that are producing these potteries.
And that leads into the next question. So, what further research do you all feel is needed to better understand the impacts of heavy metal toxicants and the impacts that it has on women and maternal health?
I would say from my perspective, the other area that I'm keen, as I had mentioned, when it comes to California AB 899, the reality is that there's a carve out for infant formula, the exclusive form of nourishment for so many children. So along those lines, it's one where it's like, we need to talk about, if we're going to talk about things like baby food safety and the inextricable link between health and mother, then we also have to have a very real conversation of, it's not just baby food pouches and cereals and the foods that are provided to kiddos, between the ages of, let's say, 4 months and a year. What are all of those things that are marketed to pregnant women, pregnant women to be, lactating mothers? All of that qualifies when we're talking about baby food safety.
And I have something, I didn't really get to talk about the extent of mercury pollution in terms of some of the major industries that are leading to mercury pollution in terms of, for example, artisanal small-scale gold mining, which Pure Earth is involved in. There are, over 15 million people involved, including 3 million women and children. And there's the use of elemental mercury and amalgamation of the gold. And that's one of the ways that mercury is released into the environment on a global scale, because 37% of global air emissions of mercury comes from this artisanal small-scale gold mining. And I think it'll be interesting to follow the Minamata Convention that came into full force in 2017 to see how countries are going to manage the mining of elemental mercury, distribution for its use in artisanal small-scale gold mining. The countries themselves working with organizations like Pure Earth to come up with alternatives to the use of mercury and gold mining. So I think sort of following that legally binding treaty to consider how we can get a grip on distributing mercury through anthropogenic emissions to really cut back on its accumulation in our fish and seafood supplies. Some of our main sources of exposure will be very interesting to follow, and then possibly, leveraging some of the health surveillance infrastructure that we have to look at exposures to women and children in some of these communities.
Yeah, Dr. Gear and I were talking about this before, about, how can we have a equivalent understanding of the prevalence and severity for mercury that we have for lead. And one of her suggestions was the surveillance infrastructure that's being built now for lead, add mercury onto it. But we have 5 minutes left and we have a lot of questions. So when we, set these things up, it's like, do we want to do an hour and 15 minutes or do we want to do an hour and a half? And here we should have done an hour and a half. So we'll probably go over a little bit with the answering the questions and allowing people to get their questions answered. So if people can stay, that's great. If not, it was, thank you for coming. Okay, so the first one is for Catherine, Dr. Schilling. So the question is, our cosmetics are better regulated in the EU than our period products. Why don't we have better regulations for period products? I think we kind of already covered that.
I mean, it's a good question, but what I said, it depends on the countries how they handle it. And what I said, the EU sees it as a consumer product. And then the regulations are different than if we had to say it in the US, it's a medical device, at least for the medical device, before a new product of menstrual products are going to be released, they have to send to the FDA a list of chemicals that have been tested. Unfortunately, that does not include metals. I have to say that. Even though they have to test for some chemicals, it's organic chemicals in menstrual products, but does not include metals. Yeah.
Okay, thanks. So the next question for you, theoretically, how can lead be leached out of tampons when their function is to absorb menstrual blood?
So the interesting thing is it's a bit more complex because while you're menstruating, your pH changes it changes. So you have a high pH, but when you have a low flow at the end of your menstruation, your pH goes down. As we all know, I have heard like people working on soils. So we know when soils have a low pH, things leach more likely. Same happens here. So lower pH, if things leach more likely from the tampon at lower pH at the end of your menstruation. And also the risk is like most of the time women use the products much longer. So there is a regulate already, because of the toxic shock symptoms, the manufacturers recommend not wearing a tampon more than 8 hours. That was the reason. But also what I said, it's like how much is leaches. That's right now we are studying that, how much leaches from the tampons and then how much can be taken up by the cells. But what I said is a very sensitive part. We cannot compare it to dermal exposure where we have much more barriers than in the vagina. So that means we need to understand, even if tiny amounts of these metals leach, even if it's just a fraction of what we detected leaches and enters the cell, what does it do to the cells? Because they are very important and they actually bypass our liver. So when we ingest any of the toxic metals via food or drinking water, it goes to the liver. So it's detoxified. Via the vaginal route, it doesn't. So that makes it even more risk for health.
Okay. All right, so I'm going to move to a question for Jackie, so I can get at least one question to each of you, and then we can circle back around. How can we use labeling to include common sense information, such as daily intake, risk, and how increasing nutrients can offset heavy metal absorption?
Yeah, I think that labeling can be one vehicle in an overall much more encompassing public health education forum. One of the huge things that we see right now, and it's, you think about the whole thing of heavy metals. I mean, today we're talking about parts per trillion, parts per million, micrograms per kilogram, very complex topics. And what we have found from our research from working with parents and caregivers is that this understanding that heavy metals being naturally occurring in the Earth's crust, but that human causes via pollution can exacerbate the problem, make it worse. Consumers believe that heavy metals are being added to products intentionally for some type of reason, which just isn't the case. But until that education, until we kind of change that narrative to kind of focus on, no, there is this inextricable link between what's happening in the environment and public health. Use your dollars as a vote for the food systems you believe in. A label is a good way to just increase that education for consumers to recognize. But ultimately, it's one where, brands and consumers are looking for all kinds of places in order to access information. And it's a great time to be a consumer. You've got some amazing social media influencers. You've got really great pediatricians and family medicine doctors. Obviously, parents and caregivers are going to reach to kind of friends and colleagues, those types of things. So along those lines, it's a matter of getting as much good fact over fear information into the hands of consumers so they can make more informed choices. And as it goes with labeling, another thing that's important to keep in perspective, just to kind of put it out there too, is that when it comes to heavy metals, this nutritional element is absolutely imperative, because the reality is that a good, healthy body eating good, healthy, nutritious foods, rich in iron and zinc, can be protective from the low level, can help protect itself from low levels of heavy metal exposure. So that's one of the problems that we have right now. We've got a lot of regulations that are coming out focused on finished product testing, but it's one where nutritional density, you can make a baby food that is low in nutritional density, low in heavy metals. Baby won't be satiated, but those heavy metal test results are going to look great. And we don't want that either. More of the good stuff, less of the bad stuff. And that needs to be something that's not a novel concept.
Great. Thank you, Jackie. Dr. Cantoral, in your research, what was the influence of other factors such as socioeconomic status on the exposure status of women?
So sadly, I have to say that we have different studies, and in the most socially marginalized municipalities or communities is where people have the higher lead levels because they are exposed not only to lead, but to other heavy metals like cadmium, arsenic, mercury, but at the same time, they face food insecurity, especially in indigenous populations. And the diet is very low in iron, in calcium, in zinc, in vitamin C. And at the same time, these populations are the ones that have the highest prevalence of anemia. And we all know that when we have anemia, lead absorption increases. So all converges in these marginalized municipalities in the country that are the most affected.
Thank you. Question for Dr. Geer. Do you partner with organizations to collaborate on utilizing their data and the LYRIC tool?
Well, we are partnering to develop the tool. So through Pure Earth and in the Pure Earth community, you know, we've established partnerships for this beta testing. But yeah, we'd be happy to extend the use of the tool and partner in any way if folks reach out. So we're really happy to, you know, get some further input.
Okay, so anyone interested should email info@pureearth.org, and then we'll get the information over to Dr. Geer and colleagues. So we have a couple more questions, but we are out of time. So I believe that our team does a very good job of tracking everyone's questions and then following up via email with answers. So hopefully that's okay for everyone. And I will hand it over to Drew.
Thanks so much, Angela. I just want to close by thanking everyone that has joined us. Angela, thank you for moderating brilliantly. And a special warm thank you to our panelists. I attend a lot of webinars and I found this particularly interesting content. So thank you all so much for joining us. To everyone who's joined us, there will be a recording of this webinar emailed to you, and it will be available on our website, pureearth.org. Please visit the institutions of our panelists to learn more about their work. Note that Pure Earth is currently hiring and will be posting a variety of new positions throughout the year. Those posts are all on our website. And finally, you can find Pure Earth's social media channels with additional information and events under our handle @PureEarthNow on all of the various social media platforms. And with that, thank you so much for joining us. Take care.
Okay, everyone. Bye. Thank you, panelists.